Hey, I'm Dr. Davis. What can I do for you today?
Well, I'm here because I am not happy with the area under my chin. I've been looking at pictures of my mother and my grandmother, and I'm worried that my neck is going to start looking like them and really aging me. What would you recommend?
Well, there's a couple of things that are related to the lower chin area. One is the bone itself and the profile of the bone. The other is fatty tissue that may accumulate in here, as well as the elastic ability of that skin. And you have two things going on. One, the exam of your chin, which I've already looked at. You do have a small chin. So we could build your chin up with a small little silicone implant, and that would improve the appearance of the chin. The other thing you have is you do have, and this is probably a family trait, as you mentioned, some extra fat tissue in this part of your neck. That's pretty easy to take care of with some simple liposuction, which can be done in the office actually, or in the operating room. Make one little incision under your chin, you can liposuction this out, and at your age, that skin will redrape nicely, and that's all you should need. Now, as patients get older, you sometimes just can't remove the fat because then you have loose skin that still droops, and we don't want to have a turkey gobbler kind of neck. So in a patient that has a few more years, we have to talk about removing the fat and then maybe pulling the skin up and back, but you don't need that. So the two things I would recommend to you today would be to do some liposuction in that part of your neck and chin under here, as well as a small silicone implant in the chin to build this chin up. That would help the profile of your face. That incision to put this chin implant can be done inside the mouth on the lower part of your intraoral sulcus there. You can do it with a bigger cut under here, but usually I make it intraoral. The risk of the silicone implant is very small, less than 1% risk of an infection or a displacement of the implant. The ones we use today are much more stable than they were 15 to 20 years ago when they could displace, and we've had very few problems with them. So silicone implant for your chin, some submental liposuction, and I think that would address your concerns today.
Great, thank you.
Okay.